Okay, let me begin. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Hello.
Good morning, everyone. Here in Indonesia and also Prof. Huda there in Malaysia. Thank you so much for having us here. Allow me to introduce myself. My name is Muhammad Ziki Aulia Al-Faroqi. I'm Secretary of Community Services here in Institute of Research and Community Services, Universitas Muhammadiyah Kalimantan Timur, or in Indonesia we call it LPPM+UMKT. Prof, as a moderator, it is an honor for me to accompany you to have this international online webinar. For your information, this international online webinar is an online discussion initiated by LPPM+UMKT that aims to provide scholarly webinar concerning various interdisciplinary topics that mostly talking about research, community services, and innovation. And in this occasion, we raised the topic entitled Potential Innovation to Fight COVID-19 Pandemic, Diagnostic and Treatment. To begin with, let me give you the agenda of this webinar. Firstly, opening. Secondly, opening remarks, and then there will be opening remarks from Vice Rector of Research and Publication, Dr. Walia Disiswanto, PhD. And after that, there will be keynote speech from distinguished speakers who will share this point of view regarding the theme of this webinar. We're grateful to have you, Prof. Huda Hasim. He's Professor on Electronic Engineering, University Malaysia Perlis, and Dr. Ghazali MH PhD, Dean of Faculty of Health and Pharmacy, Universitas Muhammadiyah Kalimantan Timur. Each will have 45 minutes to present their view. However, from the information we just received just now, Prof, I'm afraid to tell you that the second speaker will not be joining us because of the health issues. So it might be only you, the keynote speaker, Prof. And after that, we will have our discussion section in which speaker will be answering the questions. The audience might ask the question by sending it to the chat box appears on the screen. We will also likely to we will also like to kindly ask you to fill out our questionnaire. There will be a link in the chat box. You can click it and please fill out the form. And the certificate will be available for those who fill out the questionnaire. And lastly, we hope you will find this agenda that will line up for you to be faithful and engaging. Okay, let me begin to the first agenda. Everyone, the opening. Allow me to help you to open this webinar by reciting Basmalah. Bismillahirrahmanirrahim. For the second agenda, I will now invite Dr. Walia Disiswanto to deliver the opening remarks. Dr. Walia, the floor is yours.
Okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Alhamdulillahirabbil alamin. Praise to Allah, the most merciful, the most beneficent, and our salawat and salam goes to Nabi Muhammad sallallahu alaihi wasallam, their family, and the companion, and inshallah up to ourselves here and hereafter. Thank you very much. Firstly, Professor Huda Hasim from University Malaysia Perlis, who has already joined with us this morning. Also the Dean of Faculty or other head of the programs in Faculty of Health Sciences in Universitas Muhammadiyah Kalimantan Timur. This is our honor that we have the distinctive researchers from Malaysia, Professor Huda Hasim, who has already done some very important research regarding health sciences as well as biosensors. And we know already that Professor Huda Hasim also published hundreds of papers and considered one of the top researchers in Malaysia. So thank you, Prof. Huda Hasim, for coming with us. And also other researchers joining us today, also students from some faculties in UMKT, also our guests from other institutions outside UMKT. So this morning is a very important uh, talk that will be delivered by Professor Hasim, also our presenter, Dr. Ghazali, Muhammad Ghazali. However, maybe due to the health issue, the presenter will be replaced by another one delivering these presentations. I think so, but if not, then after Professor Uda Hasim, then we will go to discussions and more details about what already delivered by Professor Uda Hasim. The Institute for Research and Community Services in UMKT today is presenting the webinar regarding the very hot topic related to COVID-19. And this is a very important issue that Professor Uda Hasim already investigated and started doing the investigations related to the biosensor that can be used to diagnose COVID-19 as the alternative methods. And we hope that after this webinar, UMKT will be doing some collaborations with UNIMAS, and we can do some international collaborations, hopefully. And for your information, Professor Uda Hasim, that UMKT also will be providing international grants to the staff, and hopefully if UNIMAS can do the matching funding grant, then we can do together the international collaborations. And one of the important collaboration that we will be also sending some staff, if possible, to do PhD in UNIMAS in some of various fields. I hope Professor Uda Hasim can help us to initiate the collaborations with UNIMAS and maybe some other universities in Malaysia. I think that's all of my introduction for today, and I hope this morning we can get latest information from Professor Uda regarding the alternative diagnosis of COVID-19 that can be done by some other methods. Thank you very much for coming with us, and hopefully this will be have a barakah from Allah Subhanahu wa Taala and blessings for us all together. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Dr. Waluyo, for the opening remarks, and I will move further to the next agenda, which is keynote speech. Dear participant, we bring you distinguished and honorable speaker. The first is Prof. Uda Hasim. However, before I introduce the speakers, let me give you the background topic of this seminar. As all we know, the COVID-19 pandemic has spread across the globe, causing the damage on a scale hitherto undreamed of. According to the data from WHO, World Health Organization yesterday, Monday, September 14, 2020, there have been more than 27 million confirmed cases, with a death toll more than 800,000 deaths worldwide and spread across various countries. Not only did it had killed millions, but also it triggered many more unprecedented challenges. Economy, politics, healthcare, even social sector, they are all ruined because of this pandemic. Considering the scale, many experts say that the COVID-19 had impacted various aspects of human life, both temporarily and permanently. It also changed the lifestyle and social aspect of human. Its fast and rapid human-to-human transmission is not solely that should be feared. The fact that we live in an era of disruption exacerbates this condition. From the ignorance people who don't following the protocol to social media catastrophe, the backward of globalization to economic turmoil, or even the global race to find the virus vaccine. It is like that the advancement of technology as pillar of this era do not yet play their best role to solve it. However, all the cloud will have a silver lining. This distinguished speaker invited by LPPM+UMKT will help us to understand that we are not losing the game. For the first speaker, Prof. T.S. Dr. Huda Hasim from University Malaysia Perlis, specializing in nanoelectronic engineering, will show us that technology will be one thing we should be bad in. Receiving his PhD degree at University Kebangsaan Malaysia, UKM, in microelectronic in 2001, and had been working in Mimos Berhad, a strategic agency under the Minister of Science and Technology in Malaysia. For 14 years, he has gained vast experience in this field. And this day, he will present his research involving a handheld, ultra-sensitive and rapid electronic reader to detect the electrical signal that can convert the biological reaction into an electrical signal. It is a kind of breakthrough to a future development to a potential innovation device to detect COVID-19 virus. Without further ado, please welcome the first speaker, Prof. Huda Hasim. You may have the floor.
Can you see my slide?
Yes.
Okay, thank you very much. Okay, Assalamualaikum warahmatullahi wabarakatuh. Selamat siang, good morning, selamat sejahtera to every one of you over there, especially to the Dean, Bapak Waluyo, Bapak Muhammad, and everyone who are listening to my speech. So thank you very much for inviting me to this scientific talks. In these scientific talks, it is my honor to be a speaker for this talk. Actually, I would like to share about my current finding with respect to COVID-19. To me, COVID-19 is a very hot topic. It's very important to us, affected our life. It is very important. I think the most popular keyword at this moment. So almost everybody, those are living in the city, living in the village, jungle, knows about what is COVID-19. So even though COVID-19, the virus, coronavirus is small, but the impact is big. Small, but the impact is very big, huge. It's a giant. So that's why we have to work together to fight against this virus. So that's why the title of my presentation, I compose here as a potential innovation to fight COVID-19 pandemic, diagnostic kit. So under this pandemic, this situation, so each and every country in the world, they need two things to fight against coronavirus. One is a diagnostic kit. So the kit must be rapid, and then the accuracy must be high. So we require 100% accuracy. This one thing. Another thing is a vaccine. So these two things must be in place. So if we want to continue our survival in our own country, it's not only affect the economic, but also affect the politics of the country. And then this is the keyword of my presentation. For the whole presentation, I will touch on this keyword. Most of my word will utilize this keyword, biosensor. What is biosensor? So biosensor basically is a device comprising of these two main components, bioreceptor and transducer. And then analyte. So our interested analyte is a COVID-19. And then electronic reader. So the reader that used to read the reaction of a biological, whereby my transducer convert into electrical signal, and then I read the signal turn into a result. So everything is almost like quantitative. complementary, non-complementary, and mismatch. This is a word for the RNA, DNA. When they react, so they will can perform a complementary, non-complementary, and mismatch. Functionalization, so meaning that we functionalize the device so that they work on certain application on it. For this situation, for this case, so I functionalize my device or my biosensor just to detect COVID-19, to make it very specific, okay, detection. I want to control the specificity. So in my device, I'm using RNA as a probe to detect disease coronavirus RNA. Because according to the DNA, RNA principle, they will complement if they are coming from the same species. Okay, if they are not coming from the same species, they will complement. Okay, not complement. Okay? And then mismatch means some of them are matched, some are not. So this one also we consider as a not good result. Okay, and then rapid. So must be fast as possible so that we can get the result early, so that the doctors can act fast to the patient. Label free, we don't need to process the sample, quantitative. So the device is, the result is a quantitative form, it's not in the qualitative form, whereby if the result in the qualitative form, we need some expert. So we need an expert to interpret the data and then tell us the result. So this one also not good. Sensitive might be very sensitive, selective might be very specific selectivity, and then the accuracy must be high. In Malaysia, for the kit that they purchase from the offices, so the minimum accuracy must be above 85%. But my device, the accuracy is 100%. I will show you the result. Okay? So as I mentioned earlier, COVID-19 is a very dangerous virus. It's very small, but the impact is big. Okay, it's produced not DNA, but RNA. Okay, so almost everybody knows about what is COVID-19. It affects the whole world. And then we know the symptom, fever, cough, shortness of the breath. The only way we can protect ourselves from this COVID-19 by social distancing, and also wearing the mask. Okay. So this is what I mentioned earlier. So these two things is very important, urgently needed: vaccine and rapid diagnostic kit. Okay. So my research, basically, I'm conducting research just to have these two groups. One, the doctors, okay, so that they can diagnose the patient fast, and then they can act on the patient as early as possible, and also to help the biotech scientists to develop the drug. Okay, by having diagnose the disease, so they will identify, okay, what is the right ingredient for the drug to attack the disease. Ultimately, of course, we want to make everybody happy and healthy. Because at the moment, especially in Malaysia, to diagnose the COVID-19, for the negative, the fastest they can obtain the result within 1 day, 24 hours. Whereby for the negative, whereby for the positive result, they took normally 3 days. But my device, I can obtain the result the moment I receive extracted sample within 1 hour. That's the advantage, major breakthrough from my research. So with respect to this diagnostic device, at the present moment, everything are lab-based. We have to collect the sample from site. So we swab the sample from the person, and then bring all the sample to the lab, and then they will process everything in the lab. Of course, we require expertise to interpret the result, because everything are in a qualitative form, spectrophotometrics, colorimetrics form. So that's why we need some expert to interpret. Manual, human error, time-consuming, label-free, single detection. They have to do it one by one. They cannot do multiplex. They cannot do simultaneously many samples at one time. high expensive, okay, bulky, not specific, less sensitive. This is the problem with the current diagnostic device. Okay, that as a scientist, we have to solve all the problem. And then the demand. The demand for the diagnostic devices is a rapid, label-free, selective, sensitive, handheld, automatic, in situ. So this is the demand. Okay. If possible, you want to be diagnose or analyze anybody, especially at the border. So within 1 hour, so we know the result, and then they can enter the border without quarantine time if they are really negative. Okay. So current detection problem and solution. What you want to have basically is to solve the time consuming. Okay, must be rapid, must be very selective. Even though for the super spreader, now they have a new generation of the COVID-19. Even that particular virus also we can detect if you can make it specific. Okay, selectivity, sensitivity. So my device, the sensitivity can go until femtomolar. It's very sensitive. Even the single RNA, single DNA also can be detected. Portable, okay, so that we can bring this device to anywhere we like. Multiplex, we can do multiple measurement, multiple detection, multiple diagnose at one time, and then must be qualitative, easier to make a decision. So this example of the problem that we are facing right now, for example, for the diabetes, most of the elders, most of the children, small brothers, sisters, we are scared and phobia about the blood and also needle. So that's why we are try to run away, going to the hospital for medical checkup. Okay, so this also considered a problem. So as a scientist, we have to consider how to solve this problem. So there's in research, my strategy basically is from invasive to non-invasive. Okay, from invasive to non-invasive, and then I'm moving the sample that I'm using in my clinical trial from blood to urine to saliva to sweat. So this is my strategy in research. So what I need to do basically is to improve the sensitivity of the devices, of the diagnostic kit. Okay, from normal to normal sensitive to ultra sensitive. They have to be very, very sensitive. So that's why the nanotechnology comes in my research. So now nanotechnology have a lot to improve, okay, to deliver all these requirements. This is another strategy for diagnostic kit. So basically, so we have 3 components that we need to improve. One, the sample, and then the kit or the sensor. The third one is the reader. So the sample from lab-based preparation, at the moment, everything are prepared in the lab, and then moving to kit-based. Okay, kit-based, so we can cut a lot of time and save a lot of money and so on. Kit-based now is available in the market, but ultimately what we want is lab-on-chip preparation. But by just having a chip, small chip, so everything will be done in this chip. Okay, and then for the kit, from antibody binding, aptamer binding, but the best one is a DNA. In my device, I'm using DNA binding, RNA binding, okay? So that we can go to very specific detection. And then for the electronic reader, so what I mean by electronic is almost like if you are a diabetes person, we know about the electronic reader, the glucose meter. So the meter is an electron reader that I developed in-house by myself, okay? From analytical measurement lab-based system is very bulky, very expensive, and then I redesign. So the stages that I'm involved in my development process, and then I redesign, okay, making a small electrical mechanical system, and finally I produce a handheld low noise electronic reader. Then only we can move from traditional lab-based, novel lab-based, portable lab-based, and the handheld-based diagnostic. So this is what people are looking at this point of time. So this is what I mean. So my device is already completed. Okay, it's ready to be used. So this one save a lot of time and the accuracy based on my current validation medical trial is 100%. Okay, 100%. It's comprising, the major one is comprising of two components, sensor and also the reader. The novelty part is the sensor, the biosensor that I developed in-house. So I fabricate the transducer and then I functionalize the sensor so that they work specifically on this COVID-19. Okay, so this is the sensor. And then the sensor platform just interface, okay, between sensor and the reader. So at first, the sensor, after I drop the sample, saliva or from the swab, they will have some reaction, biological reaction. But my transducer will convert all this reaction into electrical signal. According to physics, anything that react or touch, they will introduce electronic clock. So the more they touch, the more electronic clock will be introduced. So this electronic clock I capture and turn into electrical signal in terms of current. Okay? They will tell me about the value of the current from the reaction. So this is microfluidic. This is microfluidic. Okay, this microfluidic. This is a sensor. Okay, microfluidic is just a device to handle the sample delivery. This example, lab on chip. I just drop a blood, I just drop any sample on one point, and then we go to the point of care. And then the measurement can be done, just to control the sample. So the point of care, they will receive the same amount of sample for measurement. So after I make a comparison, okay, actually it's not apple to apple. Because they are using a qualitative approach, whereby myself I'm using quantitative approach. Okay, so processing time I just require less than between 30 minutes to 1 hour or less than 30 minutes, whereby conventional 3 days. Detection limit 1 femtomolar, conventional 1 micromolar. Measurement method is a quantitative electrical signal label free, whereby the current practice in the lab in the hospital is a qualitative optical signal label free. Process flow are very simple. I will show you later in the next slide. And then the result no need expert to interpret. So these are the important things for the diagnostic. So this is biosensor, just to highlight about what is biosensor, a device incorporating or consisting of these two components, bio recognition element and also transducer. Okay. So on the right side, you can see transducer and bioreceptor, whereby bioreceptor comprising of probe and also linker. Okay. So this bioreceptor, they are organic material, transducer inorganic material, because they are coming from a different material. So I have to have a glue so that they can attach to each other, just to avoid any noise, any leakages for the electrical. Okay, that's why I designed a glue, so that the probe, the RNA, COVID-19 RNA, they can sit on the transducer. Okay. So this is the sequence that I'm using in my device to detect COVID-19 RNA. So this sequence must be similar to the sequence that they use for the RT-PCR. Okay, RT-PCR, the same sequence I'm using. And then the sequence is N-type, it's not the E-type. N-type means the process is not for screening, but for confirmation. So I'm using the N-type. For the detection, there are 3 strategies, but in my case, I'm using DNA-based detection. So it is based on the complementary mismatch or non-complementary, depend on the matching of the pairs. So this one is the probe. We can have 3 different probes. We can choose which one is the best for our device. Dilated probe, which require a goal in this sequence, and then a mine probe. So chemistry, the design is different, okay? And then carboxylic. In my case, I'm using carboxylic. This is the transducer. There are several types of transducer available in my lab here. We can choose. But for my device, I'm using IDE, interdigitated electrode, as a transducer. Okay, this transducer basically the job is to convert the biological reaction into electrical signal. So they will capture all the electrical properties, okay, to be read and display the result. So in terms of sensitivity, the structure, the smaller the better. Okay, in terms of the sensitivity, most of the my devices, the structure is in nano size. Okay, so the smallest so far, the smallest wire that I managed to produce, even I got the Genius Award from Europe, is 5 nanometer. It's very small, the smallest wire in the world. Okay, so then only we can communicate. We can work with the RNA or DNA. RNA, DNA, they are very small. The size of a DNA is between 2 to 5 nanometer. So if you want to see the reaction of this this material, okay, the DNA, so the current that we supply must be extremely small. Okay, extremely small. Its nano m is very small. Pico m is very small. Okay, then only this material, the DNA, they cannot destroy. Otherwise, they will burn the DNA if the current is too high. So I designed a device whereby they can supply, okay, the current to the sensor, very small current, very small current. So this is the principle of the RNA, how do they complement, mismatch, and non-complement. So if the pair coming from the same matching with the couple, so they will complement, they will bind. Adenine, they will match with the uracil, cytosine will match with the guanine. Okay, so when I introduce the probe on the transducer, so the probe is a single strand, and then when I drop the single strand sample, if they are coming from the same species, they will complement. Each and every pair will match, will complement. When they complement, they will introduce a big electronic cloud. Okay, mismatch means some of them are complement, some are not. What does it mean by mismatch? If you are in the sibling, okay, in the family, our DNA are almost similar. Only few of the pair are not matched. Okay, just to differentiate between brother, sister, okay, elders, youngest. There is some different. Okay, so this is a signature of ourselves. Non-complement, so they are not matching at all. So they cannot complement. So this is the principle of the DNA. And then if we want to discuss from the perspective of electrical, so when anything that touch, okay, so they will introduce a cloud, electronic cloud. So complementary mean all of them are touched, meaning that they introduce a lot of electronic cloud as compared to mismatch, and then non-complement. For non-complement, they are almost zero. Nothing is happening. Okay, so this is the principle that I'm using, and then I turn into result and then show the final result. Okay, do the calculation. Okay. So after the device is functionalized, so of course we will drop the sample. So in the sample, clinical sample, not only contain one single RNA or DNA. Normally it will consist of several maybe 1,000 of them, 100 of them, okay, a few of them, but only species which are same with the probe, they will complement. The rest, they will not complement, just floating on the transducer. So when they complement, they will introduce the electronic cloud, and then we will capture the result. So this is the process how to functionalize the biosensor before we can use to do the detection. Actually, only involve two major steps here. First, we introduce a linker, and then we drop the probe, okay, to immobilize on the transducer so that they can go to the specific detection. Okay, depend on the probe that we immobilize. For this situation, as I showed just now, the sequence of RNA is introduced in this transducer. So this is the process involved to functionalize. As I mentioned, only involve two major steps. Okay, and then after I functionalize them, I just drop the sample and then we measure. As simple as that. So we no need to have any PCR in this approach. We just use this device, drop the sample, and then finish, and then we got the result. So this is the IDE, bare IDE, and then functionalized IDE. So at every stages, so I will conduct an electrical measurement. I want to see if there what is the difference. We can see significant difference, okay, because of after we introduce, this is the principle of capacitor. After we introduce anything in between, they will give some changes of the electrical properties. This one example. So before, meaning that just IDE. IDE is a black line there at the bottom of the axis. Okay, we can see it's almost zero. In the first place, what I did is I want to know for this two electrode, what is the minimum current required so that the electron can jump from one point to another point. Okay. So of course, they will give a nano M. Then after I introduce the uptest, the linker, so they will give another result. So something is happening on the device. And then after I introduce the probe, so the blue dotted line will be generated at the 1 volt. So this is the value of the probe. Okay. So I have to do many times, 1,000 times, 10,000 times, just to make sure the value is consistent. Okay. Since the device is not after I optimize everything, so I send to the manufacturer to help me to produce the transducer. It's not done in my lab. So after the proof of concept are developed, then I send to prepare for the manufacturing. So this is the electronic reader. Okay, it's a really electronic. I don't want to touch on this. Okay, so we should so everything we have to amplify. Okay, we have to process, so, and then we have to display the result, digitize. So this is the development flow, how I develop the reader. I start my research just to get the proof of concept. Everything are done in the lab just to understand whether it's work or not. And then after I got the proof of concept, and then I redesign everything and then come up with a portable, so that I can go to site. Because most of my research I have to do it at the hospital, so I bring my device to the hospital. And then because of the commercialization demand, they told me if you want to go for commercialization, you have to produce a handheld. So finally, I developed my first handheld device so that I can easily penetrate the market in the near future. So this is the handheld. I started with number 1. I'm using my undergraduate student to develop the concept of this handheld. And then I move on until I got the final one is number 4. So this is the final handheld that I produced in my research. These are before, I complete the whole reader. So my reader, based on demand, request also have the IoT capability. So this is the request by the doctors. So they said, so they want to know the situation of the diagnosis, whether they are outbreak or not. Okay, outbreak or not. So normally what they specific for the outbreak is, they define as an outbreak is anything above 30-40%. Okay, the result is considered outbreak. Okay, let's say we have 10 samples and then 4 are positive, this is considered outbreak. If they know this is outbreak, they will come to the lab and then they will prepare the assay, go to the site just to understand the background of the problem. They will go to the site immediately. So this is also very important. I also introduce this in my device. So my device can have a live data transfer. Whatever result we obtain from the device, and also will be transferred immediately live to the phone, smartphone, to those who have these apps. Of course, the doctors, they want to know. Okay, they want to know the result, especially for this COVID-19. Of course, the doctors, the asset, the team, they will go to site, to the villages, okay, to any places, and then the result. So the Ministry of Health, they want to gather all the information. So the information we go direct to the center to collect all the information. So this is the importance of IoT, also included in my device. That's why I put smart phone close to this one to show that all the result obtained over here will be transferred to here. And also I have 2 capability for the IoT. One is a Bluetooth, the other one is Wi-Fi. The reason why Bluetooth, because if we went to the site where there is no internet, so the internet is not good, so we can transfer the data to the phone through Bluetooth. Okay. This is the measurement protocol. It's very simple. First, we have to prepare or to functionalize the device. Okay. And then the protocol is, first we collect all the raw sample, and then we have to turn. We have to turn from raw sample, we have to turn to the RNA. We have to extract this RNA from the raw sample. So for the safety reason, I don't want to handle the raw sample. I leave it to the hospital, to the lab to handle the raw sample. They do all the extraction, and then they give the extracted sample. So this sample, next we go to the PCR. I will take this one. If they go to PCR, they will require minimum 8 hours, 10 hours before they finally got the result. But I took this one and then dropped to my device. Within a second, within a few minutes, I got the result. So for the PCR, they will take longer time, days. So that's the advantage. So everything will be shown to the screen, okay, to the display. This is what I'm trying to show you. Let's say we go to the several villages, so all the data will transfer to the center, easier to collect all the data, okay. If the outbreak, Kalimantan, I think is a good, example place to have this kind of service, so that we can go to the village, very remote village, okay, and then we can transfer all the data. If the situation is very bad, then only the Ministry of Health, they can send the asset, either through helicopter, chopper, or they can go through land. So this is the flow, raw sample, RNA extraction, and then we just drop and then we measure, and then the result comes out. Okay. And then selectivity measurement, just to see the result between complement and non-complement. They show very significant difference. You see the yellow one. This is a yellow result for the complementary. As I mentioned earlier, if they complement between these 2 single-stranded RNA, so they will introduce a lot of current, electronic current. So everything will turn to the current. And then for the non-complement, there's nothing happening, even though we drop a sample. So the result is almost similar to the probe. because nothing, we cannot extract any electrical properties from the reaction. There's no reaction occurred. Okay. So this is the result. It's important result for me, whereby I'm using this result, and then I will put as an algorithm key in into my system as a cut-off value, whereby above this value we consider yes, below this value we consider no. Okay, because everything are already converted into electrical signal. So this is what I did in my development process for the reader. So this is for the sensitivity. I just to understand at what level, until what concentration, until what, how many numbers of the RNA I still can detect it. So for this one, actually I stopped at 1 nanometer. Actually below 1 nanometer I still can detect it. Based on my experience in the lab, I can capture down to 1 femtomolar. 1 femtomolar is almost equal to 1 DNA. Even single DNA also I can detect it. So you can see from here, the difference is very significant. Okay, from one after another, 1 nanometer, 10 nanometer. 1 nanometer is 10 to the power of -9. Okay, -9. It's very, very small. So, okay, this is, now we come to the clinical trial for the validation. So there are two types of validation that I have to do. One is for the system, the reader itself. Electrical measurement, electronic reader plus smartphone. So I have to make sure, and then I compare with the Kitely is a gold standard, is a standard measurement, electrical measurement. I have to compare whether the obtain the same result or not. So I start with this, and then followed by the sensor measurement. Okay, I start with the synthetic sample. So the sample I bought from overseas. Recently I bought from Singapore. So the sample came, and then I test to make sure the results according to the sample. The synthetic means the sample is very clean. And then followed by good real sample. I just take any good sample and then extract and I drop into my device. So since the sample is good, so the result must be negative. Okay. And then followed by good real sample, and then I induce with the virus. So the result must be positive because I induce the virus into the good sample. Then only go to the real clinical sample. So I start with a non-clinical sample compared with gold standard. Non-clinical sample meaning that the sample is already tested, they already have the result. And then I took the sample and then I test on using my device. So I want to know whether the result is similar or not, identical or not. Then only the final one is unknown. We just compare apple to apple, we do it simultaneously. Okay, of course, my result, I will obtain faster result as compared to their result, but I need to compare, make sure they are similar. Okay, so this is some of the result for the clinical trial. Okay, I take from Merck, Kari, Nescafe, Milo. I just took this sample. It's a good sample, and then I extract and then I drop. Of course, they will give a negative result, not a positive result. Okay, so same thing for this one. So this clinical sample testing. So how this analysis or diagnosis is conducted. So first of all, what I need to do, I just hook this sensor into this holder. I can call as a holder. Okay, and then I start to drop the linker. So after I drop a linker and then I drop the introduce the probe. Then during the clinical testing, I have to introduce another step. Is a blocking agent. Okay, I have to block after I introduce the probe. So the access probe, so I will block them. I don't want to see any signal from the access because it will cause noise to my result. Okay, I will show you the two different results. One is without blocking agent, the other one with the blocking agent. So this is just two electrodes can I measure just to measure what is the minimum current. When they are getting closer and closer, the current become less and less, less and less. And then after I drop the linker, so they will give another value. And then after I drop, they will give another value. So this one is a testing stage. Okay, everything already. Then I drop the sample. Okay. So if the sample complement, so a lot of cloud electronic charge will be introduced. If mismatch, only some, only few electronic cloud or charge will be introduced. And then if they are not complement, so there is no electron charge or electronic introduced. So the current value is a 0 or similar to the probe value. I just drop, okay, and then I incubate for 1 hour and then I measure. Incubation here means just to make the sample dry. Okay, at the moment I didn't optimize yet. I just leave it naturally, so they will dry naturally. So normally it took about 30 to 1 hour. Okay, but if I introduce or redesign everything and I include the micro heater, then so the sample will be dried faster. Okay, then close and then measure. So this one a result after I compare between Kitli, this is Kitli, and my reader. So they are almost identical. Result is almost identical, very close to each other. So meaning that they are very good. They are almost apple to apple with the standard tools. This is a sensor measurement. Sensor measurement validation. So this is on the synthetic sample, okay, synthetic sample. Complement and non-complement. Complement, they will give a yes result, meaning that in the sample contain coronavirus, COVID-19, and non-complement mean in the sample there is no coronavirus. So this is the result. The first one, this result is from the Kitli. So this value is below cutoff value. That's why they give the result no from the system. Okay. And also for the smartphone, also they will display a no result. This is a result for the yes result. I take a complement sample. In this synthetic sample contain coronavirus, and then I drop. Immediately the system will say yes, 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 yes. And then if I compare with the Kitli also will give the result of yes, 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 yes. So the red dotted line, if they are above the black dotted line, so the result are yes. So we can see the value are different. This because of the concentration are different. Okay, maybe some patients that are very severe can cause death, some are not. That's why we can still cure the patient. So this one sensor measurement validation, but I take some other virus. So I compare just to compare. So I have a coronavirus, I have an E. coli, I have salmonella. So I drop. Of course, for the E. coli, salmonella, they will give a no result. Okay. Okay. For the COVID, they give a yes result. Okay. Yes mean a positive. Okay, positive. And then for no meaning negative. And then from here, from the graph here, we can see. Okay. The total graph you can see. Okay. This one for the coronavirus, and the rest are close to the probe because there is no electrical properties are introduced from the reaction. Okay, this one is a real sample. Okay, real sample is coronavirus COVID-19 sample. COVID-19 virus, I have how many? 10 of them. So this one, I just compare between a blocking agent and without blocking agent. For this without blocking agent, the result is 80% accuracy. So I see first the PCR result, negative. This one is negative sample, negative. I took this one and again drop on my device and see the result. So the result mentioned here no, but there are 2 yes. Okay, 2 yes. These are false positive. It's very dangerous. So after I do some background study, I found that this is because of the access of the probe that can also affect the result. And after I introduce the blocking agent, so now the result is similar. I have a positive result, I have a positive result and also negative result. Yes or no, okay? So in my system, they follow exactly. Yes, no, yes, no. The major difference here, PCR requires several days to obtain the result, and then my electron reader just 1 hour, less than 1 hour, so I can show the result. Okay. So the value is important to me academically, so that I want to understand the electrical properties, okay, so that I can discuss from the perspective of electrical. As a conclusion, so the device is ready to serve the community, okay, to serve the people, to diagnose their COVID-19, just to help the ministry as well as the whole folk, okay, to fight against the coronavirus. To me, it's very important. Okay, it's very important. So I'm currently going to do more clinical trials just to have more data. Okay, even later on, I'm interested to help our neighboring country like Indonesia. I can bring all these devices to Indonesia, and then we can diagnose the COVID-19 Indonesia at the high speed, fast. Okay. If you want to, let's say my device requires 30 minutes to come up with a result. So this one actually, if you want to multiple the numbers of sample, we just have more this sensor platform, this one. Let's say you want to produce, at the moment my design, I can accommodate 3 sensors. Okay, so I can get simultaneously 3 sample at one time. Let's say you want to have 300 result at one time. So I need to have 100 of this platform. This is very cheap. We can make it very cheap. So at one time, we already have 300 samples. So if you have to have more, so we have to develop more. Okay, we have to redesign. I can redesign for one compartment. We can have 10, 20. Yes, no problem. So this for the at the moment for the 3. So everything already. So I hope I can do something to help people out there. So I think with that, thank you very much. Hopefully you can understand, because to me everything are quite technical. Okay, quite technical. Hopefully you can understand. What I'm trying to share here is to share my current funding. Okay, so that we can help each other to fight this COVID-19. With that, thank you very much. Assalamualaikum warahmatullahi taala wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Prof. Budi Hasim, for the fruitful, engaging, and what we'll say, mind-blowing presentation, I believe. Because yeah, the important thing that I highlighted here is that Professor Uda research try to change the conventional detection test approach that is lab-based, require expertise, less sensitive, expensive, not that rapid, I believe, and time-consuming, to be a more sophisticated way to detect the COVID-19 virus using nanotechnology and biosensor. And hopefully we can have a more sensitive, more rapid, and more affordable test to detect the COVID-19 in the future. I also believe that the research like this can only possible to conducted by an expert with a long experience and also passionate on his field. And thank you for the presentation. And I hope this invention can soon be implemented to the society in general. Okay, everyone. Before we proceed to the next speaker, I would like to remind you, if you have any questions or concern, you can write it to the chat box presented on your screen. And after the presentation, we will open the session for the discussion and answer. Oke, Pak Gu, nggak ada. And actually, initially we have next speaker, Dr. Ghazali MH PhD, or maybe we know him as Pak Go ya. However, he cannot joining us because of the health issues. But I will also introduce it anyway. He is Dean of Faculty of Health and Pharmacy at Universitas Muhammadiyah Kalimantan Timur. He was receiving his doctoral degree at University Putra Malaysia, specializing in public health management. He initially will present the innovation on digital technologies and public communication to counter the pandemic. And he initially will show us that the right public communication strategies in this era of disruption is of paramount importance to the mass communication. But however, because of he cannot join us, maybe I will present his abstract here. Yeah, abstract. Let me share the abstract. Okay, this is Pak Go's abstract. Innovation in COVID-19 Management and Response, Digital Technologies and Public Communication. Coronavirus disease 2019, COVID-19, emerged in December 2019 in Wuhan City, Hubei Province, China, manifesting as pneumonia in humans. As of September 13, 2020, nearly 28.7 million people have been infected globally, resulting in more than 970,000 deaths, with very high rates of disease transmission and no vaccine or effective antiviral therapy. COVID-19 is now a very serious global pandemic. Government efforts in various countries have focused on limiting the spread and reducing mortality rates, with varying degrees of success. Strategies taken include surveillance, testing, contact tracing, and quarantine. Management of implementation of these strategies in most successful countries relies on the utilization of digital technology and integrating it into health policies and services. This point of view is intended to provide a basic outline of good practices in applying digital technologies to pandemic management and response. There is a lot of evidence showing the use of digital technology in dealing with COVID-19 pandemic, especially from developed countries. In terms of epidemiological surveillance, as in last 2 decades, web-based online reporting system, social media, and online search have been used to provide an epidemiological picture of the disease. Likewise, in the testing aspect, which is intended for rapid identification of cases, many digital technologies have been used, especially those based on symptoms For example, online symptom reporting applications, febrile symptom sensors, and so on. Digital contact tracing with Bluetooth and geolocation-based smartphone applications has also been launched in many countries, although there is no evidence regarding its effectiveness. The effectiveness of public health intervention during pandemic is highly dependent on public knowledge, cooperation, and trust. The right communication strategy is needed, especially to generate active community participation. Currently, with 4.1 billion people accessing the internet and 5.2 billion mobile subscribers, messages through digital platform have the potential to spread massively in a short time and encourage community mobilization to participate positively in government program. The potential harmful misinformation and internet inequalities are issues that should be resolved. Good cooperation between the government, public health organization, and technology companies is the key to success of effort to deal with the COVID-19 pandemics. Okay, that's all the abstract of Pak Gus presentation today. And let's move on to next agenda. That is Q&A session. If you have any questions, please write down the question on the group chat, Zoom group chat, if any. For the first round of session, we will open the opportunity for 2 questions. If you have any question or concern, please write down your question or concern into the chat box that appear in your screen. Okay, there is 2 questions we have gathered here. First question is from Pak Alfi. Prof. Huda, what is the limitation of this method? Do you have the concern about the limitation of the method to detect the COVID-19, like the disadvantages of this device to detect the COVID-19? And the second one is from Pak Mada. How you collect the data specimen of the COVID-19 sample? Do you maybe he's just curious about how you the method that you use to collect the data sample.
So,
okay,
can I answer these 2 questions?
Okay. Please answer the question.
My device, there is no limitation. The only limitation at the moment is I have to do conducted a lot of using a lot of clinical sample. That's my limitation. To get the sample is very difficult because normally the Ministry of Health, they don't allow anybody to take any patient sample to do any research or analysis. It's a secret to them. So what I did is I go through a university hospital, and they had me to get the permission from the Ministry of Health. So that's why I started now with hospital, medical hospital USM. So already started with few sample, and then now I expected to have more sample. So I will go through the diagnostic. Okay, that's one thing. As I mentioned about the advantage, advantage at the moment, what the ministry require, one is the time must be rapid, because after I give a presentation to the frontliner recently, they want this to be to be developed or to be ready faster, so that they want to put at the airport, so that they can reduce the traffic at the airport, so that they can collect the sample, swab the sample. Immediately, 1 hour later, they will get results. So they will know whether the the people should go to the quarantine or they can go back to their home. So this is very important. At the moment, since there is the system is not rapid, so all of them they have to go to the quarantine. They have to stay in the quarantine camp for 2 weeks at the moment because of limitation is time consuming because they are still rely on the PCR. So mine is PCR free. No need to go to PCR. The reason of PCR because they have to amplify the signal because the sample RNA in the sample are very small. So the current system device they cannot capture, they cannot see. So that's why they have to amplify using PCR. And then the reason why they are using, they call it RT-PCR. If you notice, RT-PCR, RT means reverse transcription. Because PCR only can read DNA. But this COVID-19 is a RNA. So this PCR cannot read. So they have to convert first to change the pair. So that pair, the pair is equivalent to the DNA pair. So then only they can amplify. So this is the limitation to them. But to me, I don't have any limitation. As I shown just now, swab the sample. So the sample can be also from the blood. But at the moment they are using swab from the throat. And then from here, the sample, so we extract the RNA, same thing, they also have to extract. And then after we extract the sample, just drop to my device. That's it, finished. So within 30 minutes, so I can show the result to the respective person. So at the moment, that's why I'm rushing. Also sending one letter to the minister. I asked for the help so that I can work in the Ministry of Health. So ask them, I'm going to have a meeting with the minister, and then I will call a Minister of Health as well, and then we have a meeting. Because my background is an electronic engineer. I'm not a medical doctor. So basically, if you want to work, touch the sample, you have to have an ethic. I don't have the ethic certificate for this work. So that's why I don't want to touch the clinical sample, the raw sample. I only touch the extracted sample. Extracted sample is okay. Most of the lab, they are using extracted sample. We can give to the student. We can do the research from the extracted. From the clinical sample, cannot. Yeah. That's why, actually, I'm interested, passionate to go to Indonesia. So that I can work over there. But the problem now, I'm already asking the government, can I go to Indonesia? They say I cannot. If you go to Indonesia, you cannot come back. I cannot come back to Malaysia because I don't want to go. There are a few places ask me to go to Indonesia. Yeah, Jakarta, okay, Aceh. But I think that's the constraint. To me, that's the constraint. Constraint is to get the data. I want to develop the evidence. Because I already talked to my ministry. Please make it keep quiet first, because this one going to be, to me, going to be the first in the world. Because most of the kit, they are using antigen and antibody for the detection. Okay, some country they are using an antigen base to detect antibody in our body. That's why this one, the result is very fluctuate. Because antibody for each and every one of us are not similar. Some antibody, they react fast, some are very slow, some are not, don't have antibody. They are according to our physiology, okay? But the issue with the antigen-based kit, because to produce the antibody, they have to go to animal trial to get the antibody. Then only they can use to detect the antigen. Okay, this one is better as compared to the antigen based, the antibody. So this is their limitation. But mine actually, after I developed this device, I solved all this issue, because I already have some experience. Go through animal trial to produce the antibody, very tedious, very time consuming. If we work with mice, it's not easy to get all this information from the experiment. Very difficult. Normally people will try to run away from this animal trial. okay, to produce the antibody. I'm trying to compare myself with like say the Cambridge. They announced their kid can can come up with the result within 90 minutes. In fact, myself can be less than that one. Yeah.
Okay, for the second round of the session, maybe Prof. Pak Waluyo,
Yeah.
do you have any questions? Please deliver your questions directly online.
Okay, thank you very much, Prof. Uda, for your presentation. This is very important information regarding the diagnostic test of COVID-19. And I have a question here. I've seen your last presentation. You are mentioning about the validation of your research, the in-house research comparing with the PCR. My question is there any other device that can be considered in your validation instead of PCR, if any? Because I'm not too familiar with the COVID-19 testing device. But as I know, PCR is the very well-known testing system for COVID-19. So everything rapid test, and then the final one is PCR. I'm just wondering, is there any other devices that can be used for your validation instead of PCR? Okay, thank you, Prof.
So at the moment, there is no other equipment than PCR they used to do for the diagnostic. PCR is a must. PCR is at the moment is the only system available. That's why now for the private lab to serve the Ministry of Health for this diagnostic, they have to buy the PCR. So the ministry officer, they will go to the lab and they want to see whether they have the PCR or not. So in Malaysia, the most advanced PCR is located at the IMR, Institute Medical Research Malaysia in Kuala Lumpur. So for the positive result, they will send to IMR. Before they declare the positive result, they will send to this one. So they have the very advanced one. So PCR they cannot avoid. Okay. In the hospital, normally they have it's not the advanced one, it's a intermediate PCR. They can see the result, but for the confirmation, they still send to this one. That's why I compare my result with PCR because medical they are using there's no other alternative. They are using PCR. Okay, just to amplify the RNA from, let's say, only few RNA. Now they want to make it minimum 1,000 for the system to detect the peak of the signal of this present. So they have to be, let's say, above 1,000. So this is the limit. Below 1,000, they cannot detect. That's why they use PCR. Amplify. That's why the process, the sample preparation process is very tedious. Because for the PCR, what they do is they have to clean the sample. The sample, the clinical sample, this is so-called label-free and label-based. For the hospital, they are using label-based. When they obtain the sample, they have to clean the sample. Finally, in this sample, only have COVID-19 RNA. Then when they go PCR. If everything, they cannot go direct from the raw sample direct, they cannot. They have to process. The process of this sampling is took very long time. So this is a limitation to them. So that's why now they require rapid and accuracy. For example, initially, so they bought from Korea for the antibody-based kit. So, but after the test, the accuracy is only 62%. So they remove because the requirement must be 80 and above. So the one now they have already they are using, I think, from China. So this one is 82.5% the accuracy. So they currently they're using this one. Okay. The only thing is my device, I didn't show to them yet. Now I think it's time for me to show to them about mine. That's why I'm engaging with the minister first, my own minister, Okay, I already make appointment with the KSU and also with the DG. So we're going to have a meeting. I want to demonstrate to them. I want to demonstrate to the environment minister. Then only I will call a Minister of Health to have a further discussion. So that I can immediately bring my device to the hospital, just to help them. Instead of 3 days, now by using this one, they can come up with the result within 1 hour. That's very good. This is what the people want now. Yeah.
Okay, another question, Prof. I see from your presentation, when you compare the sensor measurement validation, COVID-19, E. coli, and Salmonella, it shows that when you use the sample of Salmonella and E. coli, it shows something in terms of the value of the current. I'm just wondering, do you use the specific value of the current that can be considered as the COVID or what? Can you explain a little bit, bro?
So this one, everything are based on the current value. So
okay.
I already optimized, just to understand what is the cutoff value. Cutoff value. That's why I have also a study on the sensitivity. So everything must be fixed. The volume that I use is microliter. The value when I drop for the probe. So this one must be consistent. So the further manufacturing to control the repeatability. So everything must fix. The first thing that I fix is the device. The device must be consistent. That's why after I develop the proof of concept, everything I work, then I'm using manufacturer Celtera in Kulim to help me to fabricate the device. So their accuracy is 100%. So these are Celtera because they are in the business. So I got from them. So this repeatability for the device is already done. And then for the chemical also, everything must be fixed. This one also done. So meaning that this is control factor. So and then finally, what I want to see is electrical signal. So for the from the sensitivity value, so this is the value that I'm using for the cut-off value, and then I include this one in my system. So the system will read any value that above this cut-off value, they will consider yes. Any value that below, they consider no. Okay, and then since the device is very, very sensitive, because I can go until femtomolar, so until, let's say, I only found one RNA in this very small, okay, just early affected, so also I can detect. That's why now we have a patient without symptom, but when we go through the diagnostic process, they are positive. So this kind of people. But normally this kind of people without symptom but positive, they have go through very detailed process to get the result, the positive result. It's very, very dangerous because they can sue the ministry. How come you claim I'm a positive, but I'm still healthy? Or very difficult. Yeah.
Okay, because in terms of the sensitivity, and then your device can show something in terms of the current, right?
Yeah,
so is any possibility if we use that device not only to detect COVID-19, but also Salmonella and E. coli at the same time? So if we see at the current value, and then the decision is this not COVID, but something else. Is that possible, bro?
I think it's not possible because so everything, the measurement is rely on the probe. So the probe is a COVID-19 probe. When we put the sequence of the Salmonella or E. coli, so the sequence are not similar, so they cannot complement. Okay, they cannot complement. So they cannot complement, and then there is no current generated from this reaction. So that's why we see the current is almost close to probe value. We can see the difference is because of maybe because of the noise. Actually, electronic noise we cannot avoid because that's why if you buy any medical gadget, for example, you just buy this glucose meter. different brand. If you drop the same blood, they will give a different result. That's why we have to be consistent on one method. This one is considered screening. That's why this is a glucose meter. So that doctor, they cannot use the result from glucose meter as a final result. No, they still go through the protocol. They want to understand everything. Then only they can provide the drug for the patient. Okay.
So the complementary is based on the matching of the DNA, right?
Yeah.
Okay. So the device will match first, and then saying whether is it complementary or not.
Yeah.
Okay. So
that's
the current is just showing that there's something detected on the probe, right?
Yeah.
Okay.
That's why now it depends on the sequence. Maybe coronavirus COVID-19 in Indonesia maybe slightly different with Malaysian. That's why this one, my sequence, I took from the KKM, from the Ministry of Health. So this is a Malaysian COVID-19. I think Indonesia is different. For example, because I already have one research recently on the HPV, cervical cancer. So cervical cancer, so in Malaysia, ours is 16. The sequence is 16, whereby in Thailand 18, Australia 24. So the sequence are different, slightly different. So meaning that the vaccine that we produce in certain country most likely cannot be used in other country.
Okay.
So this is how the disease scenario now.
Okay.
Yeah.
So what I'm thinking now is now different, Prof. So because you mentioned that Malaysia and Indonesia could be different, so there's a possibility that the research can be extended to Indonesia, Prof.
Yeah.
Then we can collaborate with you, that we provide the maybe the what you say the matching data for the DNA that can be prepared another probe. So it must be tested with the first probe and second probe and third probe. Maybe the different corona is different. That's what I'm thinking, bro.
Maybe we need help from microbiology or parasitology department to develop the probe. They know better than us. So the probe actually our sequence are very long. Then to make it specific, we have to optimize until the sequence is the best length of the. They know better than us about them from the microbiology people. Yeah.
Okay, thank you, bro.
Yeah, thank you. Hopefully, we can work together. That's why since you under UMS also have the medical school, maybe we can work closely with them.
Yes.
For the benefit of the whole.
With other Muhammadiyah university as well, not only UMKT but also UMS and maybe some other universities.
When the border open, then we can rush immediately. Okay. Because my intention is not only for this COVID-19, because the disease, they will mutate and produce new generation of disease. That's why some people say the disease after this one is more severe than this one. We have to prepare. So based on this experience, so not everything has to be in place in terms of vaccine. We have to have a knowledge on vaccine, how to redesign, how to do this and that, and also for the diagnostic kit. So we have to prepare ourselves so that when the disease come, so everything are ready. So what we need to have basically is a probe. Okay, it's a probe. So biotech people, they have to design the probe, and then we can immediately fight against the disease.
Thank you. Very good.
Okay, Prof. There is also two more questions, but the first one is from Andi Sapala, but I believe it is out of context. Does there are case of reinfection, which mean their immune system can be questioned? Does this have an impact of the effectiveness of the vaccine later? I don't believe it is in the context of what we're discussing now. But the second question is from Makbira Robiatul. Assalamualaikum. Good morning, sir. I have question about the rapid test. Is the rapid test is accurate, and what is the level of accuracy? Thank you.
Okay.
What extent it accurate, bro?
So there is two important words. One is the rapid. Okay. The other one is accuracy. Everybody are claiming they are rapid. They have to show to us what is the time consumed a moment you receive a sample until you got the result. So this meaning that how much time required to come out with result. This is rapid. Some people say, since the current one is one day, okay, let's say 24 hours, if you can produce 10 hours is considered rapid to be their definition. But now we want something that less than 1 hour. If you can go to 10 minutes, 5 minutes, it's much, much better. I think my device can go down to that level because I didn't optimize in terms of incubation yet, because I rushed to have this clinical, okay. And then the accuracy, this one have to test. Same thing also, every country when they receive the kit, they will go thoroughly test just to understand the accuracy. In the country itself, Malaysia itself, we have removed withdraws several kit because the accuracy is very low. So the government want 80% and above. But the one that they receive from Korea, 62, they remove. From Japan also they remove. And then the China, 82.5 is very close to 85. So they consider as a current. That's why for the kit, if we capture negative, it's okay because it doesn't harmful to us. But if we capture positive, that's why they send to another lab to continue to do a thorough investigation. Okay.
Okay. And one other question, Prof, from Bu Vita Pramaningsih. Assalamualaikum, Prof. Buddha. It is interesting innovation for the first detecting coronavirus. The question is, it is effective to determine who contaminated and how far can measure the antibody someone have? Thank you. It is the activity,
someone have. So actually, okay, antibody antigen is a protein level. This one I think very difficult to judge the antibody in the body. I think they have to do different analysis for this. I have no idea actually, yeah, about how to measure the antibody. But normally our antibody are decreasing according to our ages. For the youngest, their antibody are very strong. That's why any disease came, so their antibody can attack back, can fight back. But to the elders, normally our antibody are very not that aggressive. That's why we need some complementary medicine, traditional medicine. That's why we need vaccine. Okay, we need vaccine. So vaccine can help to improve our antibody. Okay. Antibody is almost like our bodyguard. So bodyguard to attack the enemy, to attack the virus. Yeah.
Okay, thank you, Professor. Dear distinguished speaker and fellow participant, I think we already exceed the time limitation for this session. Let's move on to the next session, which is closing remarks. And okay, and before that, we have sent to all of you from the Zoom group chat our questionnaires. So please fill out the questionnaires before you leave the webinar. Okay, Prof. Please give us your closing remarks of your presentation today.
So first of all, thank you very much for this sharing session. Actually, I'm quite passionate and interested to work with the UABS for the benefit of mankind, especially for Malaysia, Indonesia, and the whole world, because I already have some solution. So I think it is considered sins to me if I cannot apply this for the community. So this is so-called research impact. Okay, I want to tell a researcher, when we do research, we have to do something that can give impact to the community. We have to give back to the community. And so this is the importance of research. We are not like in Malaysia, sometimes we call it as a short sendiri. We do research just for ourselves only. No, we do research because we are utilizing a lot of funding from from people, but now we have to giving back. So research started from the problem. We have to understand the problem based on our expertise, our knowledge. We have to solve the problem through our perspective. Okay, so this is the so-called research. To me, research is a business. Research is a business. Through research, also we can become a millionaire, multi-billionaire, if we go to the right direction. So now is a opportunity for us to turn research into business. Because most of my research, I would for impact. Okay, impact is very, very important. So how to understand the impact? We have to meeting with the end user. Of course, they have a lot of problem. For this one, if we meeting with our Minister of Affairs, of course they will tell us a lot of problem. The only thing whether we can deliver, solve the problem or not. So we have to learn a lot. And then I'm using my undergraduate student just to understand the proof of concept. From here, then I develop something new by using a master and PhD student. Okay, so this is what I'm using now. Okay, based on this one, actually, I already received several calls. They want to understand, even from India, and then from UK. They just want to understand my solution. Yeah.
Okay, thank you, Prof. Pak Waluyo, do you have anything to add on for the closing remarks?
No, I think that's
Okay.
sufficient. Thank you.
Okay, thank you very much to all the participants and also the speakers. And since we have finalized the agenda of the webinar today, we would like to extend the appreciation to the Vice Rector, Pak Waluyo Disiswanto, for the support to arrange this wonderful event. We also would like to express our thanks and gratitude to the speaker, Prof. Uda, and our thanks and gratitude will also convey to our participant lecturer, student, excellencies in the Faculty of Health and Pharmacy Universitas Muhammadiyah Kalimantan Timur for your valuable time and participation. And lastly, we've come to the end of this webinar. I hope we can meet soon, Prof. Thank you very much, and by reciting Wassalamualaikum warahmatullahi wabarakatuh, I end this seminar. Wassalamualaikum warahmatullahi wabarakatuh. Thank you.